Hi, my name is Jennifer Hawkins. I am the Senior Project Manager for Community-Based Research at the Center for Advancing Health Outcomes. I just want to note that this presentation is a re-recording of a presentation we gave on May 12th, 2026. And Dr. Amy Salmon is the director of the Center for Advancing Health Outcomes, and she originally gave large parts of this presentation and is unable to be here for this re-recording. However, we do have one of the other paper's co-authors here, Daniel Snyder. And so I'd just like the other presenters to quickly introduce themselves before we get started. Daniel?
Good morning or day, everybody. My name is Daniel. I am a coordinator of a community action team in Langley that has been working on the 10-year-old toxic drug crisis. So thank you for being here.
And Mike?
Good day, everybody. Mike Sikora. I work for the city of Abbotsford, so a local municipality in which much of the study was surrounding. I'm also somebody that has walked the walk and been there, done that as far as addiction goes, not only for myself, but many of my family members. Privileged to be a co-author with on some of the papers that resulted from the study, and been a part of this project for many years. So, thank you for having us.
Hello, everyone. I'm the last one here, Steve Esau. A large part of my work is working with a not-for-profit Pacific Community Resource Society, where we work on the spectrum or continuum of substance use all the way from prevention to late intervention and everything in between. So it's been an exciting project to work with this study.
Hey, thank you. Actually, we'll keep it on the first slide. I just want to thank everyone so much, and our research team has discovered a great deal of affinity with the AFINet, so we want to thank them as well. The original research of colleagues like Richard Vellman and Jim Orford, we're especially grateful for the chance to share here today. So in our presentation, we're going to spend a few minutes on the context in BC before delving into our methods, findings, and discussion, because we're joining you from British Columbia, Canada. Okay, next slide. Go into the context.
Well, I guess that's me.
Yes, I was
What
just
do you
going to
want?
give the land acknowledgement. So it's appropriate in BC, particularly when presenting on a socially determined health issue, to name our colonial history and acknowledge its harms by recognizing the Indigenous territories in which we live. Our research has taken place on the ancestral, traditional, and unceded territories of the Stalo people, whose people bear disproportionate impacts of the toxic drug crisis, yet continue to fight for hope and healing through culture, community, and ties to land. We have much to learn from their approaches and have incorporated many of their insights and ways of being into our work. All right, Daniel, I will pass it off to you.
Right. So the province of British Columbia declared a public health emergency in 2016 due to the sudden and rising toxic drug overdose events. In BC, since then, on average, every day, more than 5 people die from toxic drug poisoning, and more than another 100 people might experience a non-fatal overdose. So these non-fatal overdoses have actually precipitated a second crisis, a shadow crisis, if you will, of acquired brain injuries that really continue to intensify and impact on public health resources. BC is, of course, also experiencing significant social impacts. Conservative estimates generally agree that for every person that is experiencing problems with substance use, that at least 4 or 5 others are very closely and dramatically impacted. And so for this presentation, we will be referring to those folks as affected family members in line with the original AFINet founders' research. So these folks also include friends, of course, ex-partners, basically anyone who might get the call in the event of a toxic drug poisoning. And our research demonstrates that this population has been uniquely and severely impacted by the toxicity of the drug supply and the surrounding crisis. We have noted in the data that men are particularly impacted. 4 out of 5 fatal overdoses are men, and that men in trades are also a particularly highly impacted cohort. I am a person also with lived experience who really saw my story reflected in the data at the beginning of this crisis. Someone who used substances alone, and much of the intensification of stress in this crisis for affected family members is really due to the toxicity of the drug supply. It's unpredictable. People who are accessing it and using substances do not generally know day to day the potency or quality of those substances. Consistently, new adulterants are introduced into the drug market, and we've seen the drug supply evolve over the last decade with the introduction of fentanyl, but now also noting xylazine, medetomidine, other benzodiazepines, highly potent synthetic opioids appearing in the drug supply and increasing the risk of overdoses, complex withdrawal, and other chronic health issues. So these complexities often are very difficult to manage, both in treatment and including with medication-assisted treatment options like opioid agonist therapy, which would be Suboxone, Sublocade, methadone. So this is causing really additional challenges for affected family members, but their needs are still largely ignored in efforts to focus and address the crisis. A lack of attention to families is reflected in two major BC government documents regarding policy and practices around mental health and substance use. So, the Pathway to Hope is a document that outlines the government's 10-year vision for mental health and addictions care. It mentions families are generally as part of a natural circle of care. However, the document really fails to provide specific actionable policy or program interventions that would address the unique needs of families. Likewise, the Mental Health and Substance Use Core Services Technical Brief is a 65-page policy document to support health systems planning, but only contains two brief references to affected family members.
I, I can speak further to this one if you wish.
Beautiful. I'll pass it to Steve.
Awesome. Yes, thank you, Dan. So as you mentioned, and a lot of documentation for treatment towards this identified toxic drug supply, families noted. However, it's not really spelled out on what that means for family to be involved. And quite often when you see it, I'm going to use the word crisis for this, for health concerns, the tendency for system-led approaches or even humanistic approaches are to go directly to the crisis. So that might be the individual that is showing the highest concern. When, however, a true holistic approach would involve all the family and the community and neighbors around that. There's a couple of reasons for that. It can be simpler to, I'm going to use the word scapegoat, where back in several eras ago, the community would put all the sins upon one goat and send it off into the forest, so that everything that they had on themselves would go to one thing, and that would be the sacrifice for whatever. I'm not saying that happens. I'm just saying we tend to project sometimes our own insecurity, our own identified concerns for ourselves onto someone else that shows a more prevalent concern that's people could see more easily. And we tend to not involve ourselves in treatment. When we look at the research, it shows that when someone is in treatment for, say, substance use concerns or mental health concerns, if they know that their family or identified or chosen family are also in treatment, their outcomes are far more long-standing than those that don't have family involved in treatment at the same time or a symbiotic relationship through it. And it can also look at it from a community lens. If you look at a healthy community, you have the individual, say, that is in higher need than others. But then in the community, you have the neighbor that's coming to give you support or food when the times are tough. You have the grandmother that has this insight from generational history and knowledge. You have the grandfather that can give new education to things, the aunts that gives the empathy. They all surround the concerned individual. And so it's a shared responsibility. However, when we step away from community, we end up isolating the problem to one person, and we try to replicate that ideal community with hired professionals. So it could be the counselor who's taking on all the roles, a social worker, etc. And unfortunately, those are 9 to 5, and they're hired relationships. They can no longer replace authentic relationship, which we have found to be the true healer. Now, next slide.
Thanks, Steve. I think we're moving on to the study setting if Mike wants to take this one.
Absolutely. Thank you very much, so for everybody. So what we're focusing on today and the outcome is from our research. And our research emerged from Fraser East, which is an area outside of the highly urbanized Vancouver region that includes several semi-urban and rural communities. So there are a number of communities, all ranging from 60,000 to 170,000 individuals in each community. And that is known as the Fraser East region, which has held some of the highest overdose rates in the province, with the majority of people dying through unwitnessed events in private residence. Now, the Fraser East also hosts fewer supports and services compared with settings such as Vancouver or Victoria, where most of the funding and policy decisions are made. Important to note, Fraser East also includes the religiously and culturally conservative Fraser Valley. So of important to note here, and there are approximately 160 churches as an example between two communities of combined 300,000 people. Equally, when you think of politically positioned, our MLAs are conservative versus NDP of the provincial government. So the setting is largely kind of more conservative in the area that we are, so we've historically resisted harm reduction approaches. And I mean, if you look back 10, 12 years, there were actually bylaws against a number of the approaches that today we would say are best practices. So, there's been some work done, but there's a long ways to go as well. At the outset of the research, we uncovered culturally embedded conceptualizations surrounding addiction that were saturated in language of tough love, including concepts such as enabling and hitting rock bottom. The language leans heavily on codependency theory, a concept used by many professionals in the field of mental health and addiction. When codependency theory is rigidly interpreted or applied, any attempts to prevent a person from using drugs from experiencing harms from their use is pathologized and contributes to enabling drug use. In order to avoid enabling, family members are often told to practice tough love, so their love can hit rock bottom. Their loved ones can hit rock bottom and be forced to change. Our work and the research we're about to talk about and have done is offers an analysis of perspectives and experiences of affected family members regarding the concept and practices of tough love within the context of the current toxic drug crisis in the Fraser East of British Columbia.
Thanks, Mike. This research is part of a larger study that used community-based participatory action research methodology, a framework that considers knowledge generation as a reciprocal, collaborative, action-oriented process where the community is involved in every stage of the research. So our ongoing project has spanned several phases from 2018 until today. The project was initiated in the Fraser East by a coalition of public health leaders, municipal government decision makers, nonprofit service providers, and people with lived and living experience of substance use and toxic drug poisonings. Most of them belong to prominent collaborative social action tables, some belong to drug user advocacy groups, and a few belong to healthcare decision-making bodies. It was a diverse group representing a diversity of experiences and viewpoints, with some personally subscribing to abstinence-based approaches and others focused on implementing harm reduction measures. These community members were looking for help to address the crisis in ways that were informed by local knowledge and context. And so Advancing Health joined the team by invitation in 2018. So I think Mike is going to talk about our first qualitative study that we did.
Yeah, I got a couple of slides. We'll do the first and the second qualitative study real briefly here. So from 2018 to 2019, we co-designed the study. From 2019 to 2020, we conducted our first qualitative study where we recruited 22 individuals who routinely use drugs alone in private residences to understand the reasons why they chose to use alone. Respondents in the study emphasized the need to balance the risk of overdose with other risks, particularly risks related to disclosing their substance use to loved ones and other important people in their lives. While family members were described as important sources of support, participants in our study also expressed shame and a need to hide their drug use from family members. As their addiction progressed, many participants described becoming increasingly isolated during high-risk drug use episodes, resulting in unwitnessed use and drug poisoning. And so, brief summary of the first one, jumping again into the second qualitative study. So then we moved further and we conducted a second qualitative study in 2021-2022 that examined the experiences of affected family members and resulting impacts of the toxic drug crisis. Like people who use drugs, Those affected by a loved one's substance use are also often hidden due to guilt, stigma, and shame. We found that the unpredictable and increasingly lethal nature of the unregulated drug market has created a pervasive sense of fear and uncertainty for affected family members. Participants described living in constant vigilance and intensified stress, never knowing if their loved one will survive each day. The risk of fatal overdose permeates everyday life with crisis management, forcing them to make their agonizing decisions about their level of involvement with their loved ones, with very few supports in place. They also reported intensified stress from accessing formal supports, with systems fragmentation, lack of access, and delays resulting in exhaustion and disillusionment. Many participants reported an alleviation of stress from connections with peers with similar lived experience.
So, as part of the initial design, people who use drugs and affected family members recommended that we include interview questions addressing the concept of tough love, as many competing narratives using this language were embedded in cultural understandings of addiction and how to respond to it. So in our study, we used purposive and snowball sampling to recruit participants for semi-structured interviews that explored experiences and perspectives regarding the toxic drug crisis. We specifically asked about their definition of tough love and their perspectives on it. 22 participants, this is in the second qualitative study. So 22 participants were recruited who identified as a loved one of a person who was or had been at risk of a toxic drug poisoning in the last 5 years. Participants' experiences and roles didn't fit into neat dichotomies such as bereaved versus non-bereaved or spouse versus parent. Some participants had lost a loved one and were still supporting another loved one, and others were both a parent or a grandparent of someone using drugs or a parent and a spouse. While this diversity limited our ability to analyze phenomenon on a subpopulation level, it did provide additional insight because we were able to discover distinct similarities in overall very diverse accounts. So we explored our data through a social constructivist lens and incorporated reflexive thematic analysis. The data that was coded under tough love underwent additional separate analysis with 6 researchers that included 4 peer research associates. Data were initially coded inductively by 2 researchers using in vivo and memos, and further codes were refined with 4 other researchers. Analysis was inductive, interactive, and comparative as understandings emerged. Candidate themes were refined collaboratively with all 6 researchers. And so I'm going to move to our findings right now. So I'm going to go through some of the main themes that we have written about in our paper. And then Daniel and Mike are going to kind of jump in and add some of their personal perspectives. And then at the end, Steve is going to take us through a discussion on our findings. So we knew that at first we needed to explore how affected family members define tough love, which was particularly tricky because even though codependency language was pervasive, people often seemed to mean very different things while using the same language. And even if they did mean the same things, they often had different relationships with and responses to those concepts. So most participants referred to tough love as involving some form of withdrawal. For withdrawal from the loved one, although it involved varying degrees of severity. So someone might refer to tough love as getting kicked out of the house and say, oh, tough love was the thing that finally got me to get my act together. But then another person might refer to tough love as cutting off all communication and say, oh, we need to throw tough love out the window. It became clear, however, that participants' engagement with tough love language and concepts was intertwined around the often agonizing decisions they faced regarding their loved one. We found that tough love concepts interacted with 3 main factors: perceived potential outcomes, beliefs, attitudes, and values, and available personal assets or social capital. So moving on to perceived potential outcomes. For the majority of participants, chaos was frequently linked to their loved one's substance use, and they felt that they needed to consider the safety of themselves as well as others, particularly other family members living in the home. Participants would often decide to withdraw support or increase distance in response to perceived threats and a desire to protect more vulnerable family members. So we have this quote: he was owing people money, we were living off my paychecks and getting further and further into debt, and I'd wake up in the morning and he'd be ranting and raving with a blowtorch over the burner, and he flooded the basement because he'd forgotten his pants in the sink, and it was just a lot of craziness. And my son said to me, I need a break. And so, when your 10-year-old is saying that to you, things are too crazy, so we left. So these kinds of chaotic circumstances and high stakes decisions were pervasive in our data.
Can I jump in there really quickly, Jen?
Yes. Yes.
I appreciate this slide, and one of the things that really stands out to me when I think about this perspective is we often think of tough love as something I'm doing to somebody that is in the throes of addiction. But when we think about these potential outcomes, they're actually barriers that, based on this slide, is what we're putting up to protect our inside. So it's not necessarily something thrust upon somebody else. It's to preserve the sanctity of our home. I can go back to a time when I was supporting, and my brother's very open about his addiction journey. We had a 7-year-old kid, son in the house, and an 11-year-old son in the house, and the 7-year-old had to call 911 because he had overdosed, and he was giving him CPR on the floor while they were waiting for a hospital, for the ambulance to show up. And I think about the chaos and how the family unit had to say, hey, we have to draw a boundary here to protect the sanctity and the safety and the trauma that my children are going through. So again, it wasn't to thrust upon an individual because of something directed at them. It was more of those boundaries. So tough love's an interesting concept. I know we've talked about this lots. I know the papers talk about it as well. It's often it's actions, and we put them under a category of 2 words, tough love, but they're often responses that we feel we need to do for our own personal safety and well-being as well. And so I just very much appreciate this, because there are varying levels of that as well. How do we protect against the unpredictability? I know if Amy was here, she would use the term, we're running out of cope. And we get to a place where it's really hard to continue to do the things that we're doing. And so I get it.
Yeah. A lot of you highlighted some of the anxiety and how fraught some of these decisions are. So I'll go to the next point under perceived potential outcomes, linking it with rejection. So their participants were deeply concerned about the impacts of their actions on their loved one. They worried that their loved one would feel unloved, abandoned, ashamed, or turn to survival sex or suicide, sex work, pardon me. Participants also worried that practicing tough love might worsen their loved one's addiction, and in the context of a highly toxic supply, the possibility of death loomed large. Some participants described tolerating chaos or jeopardizing their own safety out of fear for their loved one, which appears in the comment here of the reasoning that Amy had. Not doing tough love, she fears her child would have ended up somewhere she shouldn't have been, but the only reason she's there is because I didn't open the door. I even know a mother that said that at the funeral of her child. The day before, the child was at the door and she wouldn't let him in, and he died. And I said, I'll never be one of those parents. I'll never do that. Any comments on this one?
I'll just jump in and say that I think that this highlights like the complexity and the uniqueness of every individual that's impacted by substance use, and that when people have, maybe innocently enough reduce a concept like tough love to a set of rules or guidelines, or the way that they're just a formula of operating, that's when we fail to consider the uniqueness of people and the different supports or approaches that they might need. So.
Okay, and moving to the second point of beliefs, attitudes, and values. So if we can move, yeah. The application of varying tough love approaches was also mediated by moral reasoning, particularly around the nature of drug use, the importance of love and compassion, and a belief in personal agency and accountability. Notably, regardless of their level of lived experience, whether or not they had been a drug dealer themselves in the past or had no exposure whatsoever to barely even, say, cannabis use, no participants felt that their loved one's substance use was positive or beneficial. This was in our findings, in our participants. All of them desired change in their loved one's relationship with substances that reflected a belief that their loved one's use was harmful to some degree. All participants, though, stressed the need for love or compassion, every single one of them, even when beliefs regarding drug use differed. In many instances, participants were caught between demonstrating tough love with what they believed was unconditional love demonstrated through compassion. So you can see that in this quote. Well, tough love's I'm not going to let you rob me anymore, so you don't get to live under this house anymore. Doesn't mean we love the person less, but in their eyes, now they've been rejected and abandoned. Their core fears of not being lovable are all going to come into play, which is going to just feed the addiction. Daniel, Mike, anything here?
There we go on mute. I this one hits home as well. I mean, I grew up in a home where there's two of us, and so I can speak to my experiences only. Two of us as addicts, and so my parents were actually put in a position like this many times. Like, I love you, children. You are my flesh and blood. We raised you. However, this quote talks about robbing me anymore, and that's something that often goes hand in hand with addiction. When you're lacking resources, you do things to get the needs met. And we unfortunately had to live in a home where there were locks on doors, and eventually, hey, I'm not going to pick you up because I know you're only coming home to get something to bring out of the house. And so understanding that, we don't always understand that in the throes of where we're at. That fear and rejection is real. When we can take a moment and get our heads out of the clouds, or there's somebody to be able to walk alongside of us and articulates kind of some of the impacts of decisions we've made, and taking them outside of who am I as in my core being, but versus the decisions, the choices I've made, my actions versus my identity. But it's not easy to do, especially in the midst of mess and chaos. And hindsight would suggest certain things, but it's very difficult in there. It's tough walking down this road from as parents or as loved ones or as friends, or being in the middle of it. It's messy, it's complex, and it's heart-wrenching.
Mm-hmm. Yeah. So moving to beliefs, attitudes, and values. And I think I'm going to, after this, I'm going to give one more chance for Mike and Daniel to talk. We are just keeping in mind of the time. And then after Steve does the discussion, if Mike and Daniel, if you have any more things to say, then we can say it there. Because of the next, yeah. So going to beliefs, attitudes, and values. So many participants spoke of their belief that their loved ones were capable of some degree of choice or agency, and their actions required a corresponding degree of accountability. They felt that their approach as family members required imposing consequences, and that they often associated with tough love concepts, such as refusing to give money or not allowing their loved one to live with them. And you can see this in the quote below, which reflects a belief in it and compassion, needing a level of accountability or responsibility in your own direction. And I've seen that in my own life, tough love. When you make a stupid decision, guess what? There's consequences for that. And well, if I'm in a position to reduce the impact of those consequences so it doesn't knock you right off your journey, then you better damn well be sure I'm going to do that. And then we have some powerful quotes on how fraught these things are for family members. Despite their nuanced perspectives, participants often struggle to reconcile seemingly competing values, and they experience considerable uncertainty and internal dissonance. So Maddie and Melissa, the mother and wife quoted earlier, both express this anguish struggle. So Melissa's saying, I tried everything under my power to do it not a tough love approach way, and it didn't work. And the only time I even got him to consider going to rehab was when I went and stayed at my mom's place and said, you need to get help because we're scared because things are getting too crazy. And did it get him into treatment? It did get him to treatment, but did it keep him alive? It didn't keep him alive. So we recognized fully just the complexity, the confusion, the tragedy that family members and chosen family members were dealing with every day. Mike and Mike and Daniel, just anything to say here?
I think this is a great conversation piece, and I know that Daniel and I, we probably come from different sides of the coin on some of this stuff. I mean, I know that there's the kind of the harm reduction approach versus the abstinence, and I mean, there's varying degrees of that. My journey, I had the rug pulled out from me. I would not have stopped. There were many people in my life that were, giving me support, offering me a hand up, all those things. I was so deep entrenched in my addiction, and we're going back 25 years here, that no matter what you gave me, I took it for myself, but not to get out. And the only thing that changed me was the justice system saying, you don't get to go past go now. You're going to go away for 4 years. So for me, that was that tough love approach, I suppose, or it had some characteristics of what tough love would look like. We're not allowing you to keep doing this. You're causing harm. You're harming yourself. You're harming the people around you. And for me, that was actually the game changer. Now, that's not everybody.
Yeah.
I think of the other side of that coin. And Daniel, go ahead, please.
Well, I think the key here is not that there is a correct approach or one is right or better than another, but rather that this should inspire curiosity for us to attempt to understand our loved ones in a deeper way. What is this substance use about for this individual, and what kind of supports would actually help them? And I find that oftentimes when they're stuck and family and caregivers are frustrated and the loved one is not changing their behavior, that often this is simply about a misunderstanding of what the substance use is about, and also trying to squeeze that person into an approach that maybe they're not resonating with. The quote that we just read about getting the person into treatment. I mean, often that is the default kind of approach that family members take when they identify a loved one that has a substance use problem. They need to go to treatment, and perhaps that conversation isn't expanded enough to add other supports or pathways into that, because treatment is not the only way of helping a person through substance use.
And we know these things, right? But how difficult is it to sit down and process all of this while you're in the midst of the ambulance just took my son away from an overdose out of my basement when I found him naked, and my other son just robbed us of our jewelry, all of our jewelry boxes, to sit down and say, how can I be curious about this? It's tough. It's not at all to invalidate the depth that we need to go, but when we're talking about affected family members, does it ever become a difficult, fraught, complex place to be?
I mean, highlighting the need to provide supports to those individuals so that they can understand how to properly implement boundaries and into their lives and into those relationships, and when they need support that goes beyond themselves.
My mother would tell you that was the shifting point for her, is getting that support outside of the home, recognizing there is somebody there to walk alongside and help her see those things, in the midst of the chaos. And so that was the make or break thing that helped her get through it and support her family, although there were very different perspectives. Mom had one,
Yeah.
dad had another.
And I wonder, I mean, in your situation, Mike, because I know some of it, like if that was perhaps delayed because of the shame that of having children with addictions, and that you don't want to disclose this experience to people in your community or outside of you because of the way people feel, especially parents, perhaps, that they are a failure or have contributed to this situation.
Absolutely. Absolutely.
Yeah.
Well, you guys have set up perfectly a little advertisement for our AFINet presentation at the conference in September 2026, because we're talking about the next stage of our research of designing interventions for substance affected families. So thanks for that. Moving to the last main point, the of available personal assets. So the level of severity in the application of tough love concepts appeared to increase as people described a need to rapidly change behavior of their loved one that had escalated beyond their capacity to cope. So this in turn was mediated by their social capital, including lived experience, education, spirituality, relationships, and professional support. It is notable that relationships and formal support did often bring worse stress to participants who often felt judged by friends or frustrated by a lack of access to addictions services. And you guys touched on this. Interestingly, intra-family conflict often centered around competing levels of severity or values placed around tough love. For example, a husband and wife might disagree on how to handle requests for money, or siblings might want cut off contact while the mother doesn't. So it was clear that finding the one person who actually gets it offered significant alleviation of stress. And last one, boundaries here.
Jen, hey, can I pop
Yeah,
in and
yeah.
say also that I think loved ones are often dealing with competing advice.
Mm.
because external inputs often have different views, of course, of their own. And I remember in my own experience, like my mom dealt with a lot of different input, some people telling her to, kick me out, and other people contradicting that. So it's very complex for a loved one to know what the right thing to do is when the advice is also very confusing at times.
Yeah. So I think I'll just summarize this one really quickly um, about assets. When participants had a lot of feelings and confusion around tough love and those dichotomies of enabling and rock bottom and all of that, the the concept of boundaries seemed to offer more of an alleviation of stress. Um, so I'm just gonna summarize that there. The ones who had permission to negotiate with their loved one in an empowering way seem to be better off. Um, so I'm going to move to the discussion for Steve. And we have a little bit of room, Steve, just because this isn't a live meeting anymore, to get some of your really helpful concepts. So please feel free to say what you
Thank
need
you.
to say.
Yeah, happy to discuss or as well open it up to other fruitful thoughts because I think the discussion part is bringing up those other concepts that are very helpful to promote. So as you can see from my wise colleagues, and they eloquently said it very well, uh, the terminology of tough love and rock bottom contains a chasm of subjectivity, and as a result, we have to be cautious in why we are using it. There's a couple different rationales behind that. One, even when I work with people that are caught in an unhealthy relationship with substances, I don't feel it's my place if they say I hit rock bottom and it's somehow motivating them. I don't feel it's my place to take that away from them unless it's doing some unhealth. What is the motivation behind using it is really the concept we're trying to get behind. If you're using the concept of tough love, and say someone that's using it that isn't in an unhealthy relationship with substances, what is their motivation behind using it? Is it because they feel exhausted and they need to draw a boundary? Is it because they're trying to contain chaos? There's many different things. So my big notion is, and I really appreciated Daniel's point, is if we looked at it from curiosity of like, what is this? But in order for curiosity thought to happen, there needs to be slower brainwaves and less chaos. So where does community come in to create that? So each thing stems with relationship, which I'm going to talk more in the next slide, but you don't have to jump ahead quite yet, Jen. Um, and I also want to briefly touch on the term rock bottom, and I'll speak sensitively to this too, because for those that use it and they feel that helps, I don't want to take that away. Once again, why are we using the term? What is the motivation behind it? And if you look maybe back at its origins, or one of the reasons it became is because there was this idea, this concept that if people have intrinsic values, say relationships or just values of relationship, money, finances, like just things that they truly value more than substance. And then that substance starts to compromise them, where all of a sudden their substance use resulted in social embarrassment. It resulted in an affair. It resulted in financial things. That will somehow motivate them because they hit their rock bottom to get out of it, to have motivation to change their behavior. However, we can't really, like from its origins, maybe it made sense at that time, but however, drugs have changed drastically. They have completely changed from maybe when it was, and alcohol is devastating, don't get me wrong. However, we have a synthesized drug of heroin turning into fentanyl to today, probably a new variation of fentanyl came out that we don't even know yet. And we don't know how it's going to affect people. So if you're waiting for a rock bottom through continued use, there's a way higher risk of death, to be blunt. So I don't know how safe it is to use rock bottom as a term anymore. That's probably where I'll stop there, unless you want to go to the next one. The topic of relationship is such a passion. And there's this funny thing. I think one of our meetings, I don't know if you all remember, we all kind of had this sigh of like, why does every research on substance use, everything always come back to relationship in our findings? And it totally is true. And I think I'll spend the second half of my life researching it because it just seems to be the true healer. And if you're looking to explain that a bit further, oh, we switched slides. Oh, all right, there we go. Mike's having fun. Should I pay more attention to you, Mike? Um, to explain relationship connection a bit more, fascinating, back to the point of curiosity. Why the substance? If you look at, say, heroin works on the endorphin network in our brain, which is highly responsible for pain relief and also relational connection. And so when you have healthy relationships as a child, it develops an endorphin network where if you feel pain as an adult, you have internal coping strategies that are going to be able to respond to that from a neurological sense. Now, if you have a childhood of abandonment, pain, trauma, neglect, the endorphin network may not develop to the point where when you're an adult and you feel pain, it's the equivalent of, say, having a headache and you take a Tylenol and the headache remains. You're going to keep taking another Tylenol in order to, or aspirin and pain relief to get rid of that headache. So imagine you were born without a limited endorphin network where pain just does not go away. And so what they found is heroin works on the exact same network as pain relief endorphin. So they're replicating relationship and pain relief. So when they ask why are they using these drugs? It's devastated their life. It's they need to hit rock bottom. We need to show tough love. It's we could also include in that discussion why are they in pain? Not why the drug, why are they in pain? And when I sit down, my work is in clinical services with counseling, and I meet someone that's been, say, using heroin or fentanyl for a myriad of years, I don't ask them those questions. I ask, tell me about your childhood and tell me about your relational connections. And then tell me about their relational connections, who's supporting them. Because fentanyl is just an attempt at replacing relationship. And so when you see these overdose, I don't see the coroner's report as motivating to data to change. I think what I see is how we developing safe, healthy communities that's going to limit the amount of overdose going forward. So anyways, relationship wins in summary. And my colleagues can speak very eloquently to that too. So if there's any other points.
Yeah. Daniel?
Thanks, Steve. Well, I think, I mean, historically, many people know just by their experiences with substance use that the way we've approached them for the last 100 years has been through disconnection, through separating and isolating people, through imprisoning people, et cetera. And so anything that we can do that counters that, that pulls people closer to ourselves, that builds connection, that builds hope, that builds relationship, I think is part of the healing process, part of helping people begin to find a recovery journey. And I think also the concept of rock bottom has some cultural ideas like just embedded in it, right? Like rocks just fall on their own. There's no intervening once it's started to drop, and we're just going to let it go until it hits the bottom. Well, I mean, substance use doesn't. That's the idea that drug use goes only in one direction, right? The slippery slope. Once you begin, it's downhill from there. And I think that, you know, we know from our experiences, I know from mine that it's not quite like that. It's up and it's down, and there's interventions that can mitigate harm along the way, such and that we if we build a more holistic kind of recognizing the spectrum of substance use narrative into our culture, then we can see ways of intervening along the way that we don't just let people go and hit rock bottom. We're there walking with them and hoping to prevent that total catastrophe, right?
Thanks, Daniel. I think if we can just get to the last slide. We had a really great discussion about this with the participants in May that actually did get recorded. So hopefully they can fuse these two things together. And just want to say thank you. And thank you to Steve, Mike, and Daniel for re-recording this. And I think I'll sign off there. Is that okay with everyone? Mike?
Thanks, everybody.
Okay.